Go.
Alright, I'm going to be doing a basic IV insertion. I would go ahead and verify my doctor's orders first thing. I do indeed have an IV insertion, and then yes I do, so I'm going to go ahead and gather all of my supplies. I'm going to gather an IV start kit. It's going to have my gauze, dressing, gloves, alcohol, ChloraPrep, tourniquet. I'm going to get two 20 gauge needles. I chose two 20 gauge because the IV is for fluids, but I also want to be able to offer blood transfusions if need be. I also am going to have a 10 milliliter syringe, some normal saline, a needle, INT extension tubing, extra alcohol swabs, and a normal saline. So first thing I do, take all of my supplies, I'm going to knock on the door.
Come in.
Hi, I'm Carissa. I'm your nurse today. I've got a doctor's orders to give you an IV. Can you please give me your name and date of birth?
Kelly Smith, 01/10/94.
Alright, and the armband matches. So have you ever had an IV before?
No.
Alright, well an IV is basically where we put a plastic catheter into your veins using a needle. We take the needle out, but we leave the plastic catheter in there to allow for medications, fluids, blood transfusions, and things like that. This is so you can get some fluids in your system, okay?
Okay.
Have you ever had a mastectomy or have any dialysis ports or fistulas?
No.
Alright, then are you right or left-handed?
I'm right.
Right-handed. Great. Then we're going to go ahead with your left arm. So I'm going to wash my hands. Hands are washed, washed, washed. Put on my gloves. I'm going to go ahead and prep my supplies now. I'm going to drop 3 milliliters in.
Some tape.
Thank you.
This would be going into the
With IV.
sharps container.
With the IV.
Do you have any air bubbles? Do I have enough to the front? I'm going to open my extension tubing. Making sure it's open. I'm going to apply some positive pressure here.
Got clear tape.
Mock it off, now that it's primed. I'm going to go ahead and evaluate the arm. Palpate. There are no other sites. I've got my vein. So I'm going to go ahead and get this open. And actually, before I start, I'm going to get some tape ready. I'm going to place my tourniquet.
I'm just going to do this. I'm not like practicing. I'm just starting to so we can do that.
And take an alcohol. I'm going to clean my site. While that's drying, I'm going to put my initials, the date, and the gauge on my tachyderm and get that ready. That's dry. I'm going to now use my ChloraPrep. Do a second clean in a circular motion outward. Oh, that looks pretty dry to me. All right. I'm going to pull a skin taut. I'm going to go at a 15-degree angle. And then can you go ahead and relax? You're going to feel a little pinch, okay? Stick in. I see a flashback, so I'm going to advance the catheter. I'm going to tourniquet. Sharps container.
Why didn't you do the shoulders too? Because that's all that
Attach my tubing.
like this, and then
Oh, I didn't even bother to do it.
I'm gonna release this. I'm going to have a push, start, push. After I aspirate. Aspirated. There's blood, we're good.
Should it be further
I
up?
don't see it because I was going to do range of motion of the shoulders with the upper extremities.
Oh, I'm so sorry.
Just like, yeah, you just gotta.
Positive pressure, I'm going to close it off. Throw this out. Now I'm going to go ahead and clean up any extra blood or fluids or anything that I have around this before I put the tachyderm on. That's dry.
Okay.
Yeah, no, I want to finish this.
Oh, I didn't even do the pulses in the arm. Whatever, I'll do that.
Go ahead and place my tachyderm. And I will place my initials on there. I'm going to go ahead and leave it now.
Do they need more people?
I'm now going to clean up the area a little bit. Make sure all of my sharps go into their sharps containers. Sharps. Then I'm going to make sure the patient's comfortable. I'm going to make sure they're in the lowest bed position. I'm going to make sure that they don't need any of their personal items or that they don't need to go to the bathroom or anything like that. Once they're completely comfortable, I'll finish cleaning up the rest of my area, and then I will go out and I will document. I'm going to document the date, the time, the size. It was a 20 gauge catheter, 1 inch, how it was taken, when I assessed the area, that there was no phlebitis, no signs of phlebitis or infiltration. There was no redness, swelling, irritation, or anything like that. I would also note that I told the patient to go ahead and notify any staff if they needed to. Yes. If they needed, notify the staff if there was any irritation or pain or any swelling or anything like that. And that's it.